Becky again. Tonight I want to talk to you about tennis elbow, or also called or referred to as lateral epicondylitis. It's right here on the outside, so if you have your palm facing front, the outside of your arm, you can kind of push on that little bone, and right down from there you're going to be just about on that tendon. It's about 3 fingers, and that's where you're going to have the pain. Doesn't have to happen from tennis. It can also happen from numerous repetitive activities. If you're a plumber, if you are a carpenter, from running the sweeper, even pulling weeds, like different activities can actually cause this. So what I want to talk to you about is, and I've had it, and it is very painful. Mine actually occurred from an injury. I slipped and fell, landed on my arm wrong, and I ended up having an injury. Again, physical therapy and chiropractic care is extremely beneficial when you're trying to deal with that pain, and it does get very severe. If you've ever had it, you know that's probably why you're looking. If you've ever had tennis elbow, it is very painful, and it is a lot of improper use with the wrist. So you can purchase a strap. They actually make them for tennis elbow. You go 3 finger widths down, and you can place the little pad from the strap or the brace, and then it takes the pressure off of that tendon. So your muscle belly is through here, which you perform this activity, but that tendon comes out, and that is how the muscle attaches to the bone, and that tendon becomes inflamed. It's almost as if you have like a rope, and if you would take a butter knife and kind of rough it up and you get those little frays, that's kind of what happens in there, and it turns inflamed, so it gets a little more puffy in there and very sore to the touch whenever you palpate. So ways to help get rid of tendonitis is specifically for the tennis elbow. Ways to get rid of that, you want to ice this down. Now it's very good also to have a massage, and if you have a partner, someone that could help you, we call it a transverse friction massage. So what you do is you place the fingers, or your partner would place the fingers, because I'm not able to do it myself, but if someone would come and place their fingers right across that tendon and just rub back and forth, kind of up and down that area, that increases the circulation, increases the blood flow, and will reduce your pain. In addition, you can take over-the-counter anti-inflammatories such as Advil, ibuprofen, etc. And then after you do that little massage, you want to ice it down. One of the perfect ways is take a little styrofoam cup, fill it up with some water, and freeze it. Beyond this, now there's also physical therapy things that can be done, anti-inflammatories put on there, some treatments that can go into there, but if you're trying to heal it at home, that's what this is for. So in addition to this, you need to strengthen that area because things get a little bit wobbly, unstable in there with that inflammation because everything's painful. So you can also get a little brace for your wrist, just so you're not flicking the wrist back and forth. Some people, even when they lift weights, they'll use their wrist. When you're doing a bicep curl, it should be focused on the bicep. So you can get a little brace, not one that you wrap up and that locks that wrist in place, but that you put it on there and it just makes you aware of how you're utilizing that arm. So beyond that, we want to do some stretching. So your wrist extension, you want to hold it down, and this is going to give you a nice stretch for your wrist extensors. Again, that's in that forearm. You want the arm to be straight. A good stretch is 30 to 60 seconds. You only need to do 2 to 3, so it's not too long. Then you're going to work your wrist flexors. You're going to straighten and you're going to stretch this way. You can also do it like this. I kind of like it like this just because you get a little, you pull in a little bit of bicep and everything's kind of connected. Some other strengthening exercises is, I have my little table here just so I can show you, and a nice small weight. I have 2 pounds. You could use 1 pound, and if you're really having trouble, you just start out no weight. So you have the option. So you're just going to rest your arm and you're going to lift up. So you need to build all the directions. And again, with the weight. So the next direction, we're going to go thumbs up, and you're going to lift up this way. A lot of times these are just a little bit harder because these are directions that we don't normally use. So we went thumbs up. Now we're going to go pinky up. So sometimes you might have to lean into it, and you're going to lift. And then we're going to turn it over, and we're going to curl up. So again, not up here. We're just using that form, and that's why we're placing our arm on the table. And another very important activity is just twisting the arm. So it's pronation, supination. So it's turning the palm down and up, down and up. But you want to tuck that elbow in, or you can have it resting, if I was just a little bit higher, turning it down and up, down and up, because we want this to come out of the elbow and not out of that shoulder. Another excellent one is if you just take a towel and twist it. That's very good for those forearms. And if you have it on one side, if it's not an injury, like mine was an injury, but if it is more repetitive use, you know, using it improperly, maybe getting a little bit too much wrist control, you want to try to do both sides, because we want to bilaterally, both sides, we want this one to function like this one. So if this one's injured and it's from a repetition, you want to work that other side. Even though you might be right-handed, it's just beneficial. That way you don't end up with any weakened sides and issues with like some instability. Thank you so much for joining.